While 10 million new COVID-19 infections were recorded globally, South Africa has seen a 20% decline. Hospital admissions also saw an 11% drop. The death rate is also going down. In fact, this week, daily deaths hit single digits, with none recorded on Monday. Health Minister Joe Phaahla gave an update on the situation earlier today. The eNCA's Heidi Giokos has been monitoring that briefing and joins us now. Good morning, Heidi. What's the overall picture of COVID-19 infections in the country?
I must say, Fundo, it seems to be dropping significantly. Many were worried that there could possibly be a fifth wave looming, especially when the country moves into colder weather conditions. We've always seen some kind of new variant or wave emerging, especially when South Africa moves into the colder seasons. But the health minister says it is encouraging. Almost every single province has seen a decline, except KwaZulu-Natal, which has not moved much. But what we do understand is that the death rate has decreased, as well as hospitalizations. This is extremely important, especially because with the new variant that we saw coming about last year, Omicron, it was very important for the health department to assess what exactly is happening in terms of the death rate and hospitalization. So one needs to establish how serious this variant is. And it seems as though those that are unvaccinated are the ones that fall very ill and are often hospitalized over those who are actually vaccinated. There's another concerning picture. It seems as though the younger age group, so the teenage group, seems to be getting hospitalized a lot more than the other age groups, and a lot of it has to do with the fact that they were locked.
All right, we seem to have lost the connection there with Heidi. That was our reporter, Heidi Giokos, just giving us the overall picture of COVID. Let's actually listen into what the Health Ministry had to say.
The percentage positive was highest in the age group 10 to 14 years of age, which was on average 21% positive in this age cohort, which is obviously worrying. That it means that we're getting more positivity, more positive cases at the younger age group of 10 to 14 years. We did say last time that this was possibly because of school opening, but it looks like the trend has persisted.
We seem to have re-established that line with you, Heidi. Now, another big worry is that some vaccines are expiring by the end of March. What is the ministry saying about this?
Yes, so what we do understand that it's most likely going to be the Pfizer vaccines that will expire at the end of March. And that is a concerning picture, Mfundo, because it just shows, one, that the vaccine uptake is not where it should be. Government is struggling to get people to get vaccinated, especially the younger population. And there's some comfort in the fact that the older population, the most vulnerable groups, are getting vaccinated, but the younger population not getting vaccinated. We have about 23 million vaccines in the country at the moment that have not been used, and about 100,000 of those Pfizer vaccines are expected to expire at the end of March. Government needs to find a way to utilize those vaccines before they expire, because it becomes a very complex process when one needs to discard of expired vaccines. There are a lot of factors at play when that happens. So government is trying by all means to get people vaccinated, and hopefully we don't reach a point where the 100,000 vaccines need to be discarded. But let's further listen to the Deputy Director General on this matter.
We just confirm that we do have more than 20 million vaccine doses on stock. Now, at the current moment, we are pleased with the pickup in terms of the vaccinations as reported. There is definitely a risk that at the current moment there is a risk that just over 100,000 or so doses which will expire at the end of March, that those may have to be discarded So there is that possibility. We're looking at that, working around, seeing whether there may be other alternatives, but it does look likely at this stage